Good morning, everyone. Dr. Alexander Thomas, the Chair of H.E.L.P, Dr. Raj Shankar Ghosh, the Convener, and Dr. A. Lingayya, the Chair for the H.E.L.P Conference 2026. It is a great pleasure to know that the Health and Leadership Platform is organizing a leadership conference in Hyderabad today at Yashoda hospitals. I have happened to know the H.E.L.P network for quite a time, and specifically the role that it has played in working towards reduction of the environmental footprint in the healthcare sector, especially through the collaborative work of bringing together the evidence and also of sharing of the innovations and the knowledge that the health institution bring together for each other. I have happened to know a number of H.E.L.P committee members and have worked with a few of them. We are very happy about the work that H.E.L.P is doing in India by bringing together a large number of hospitals and healthcare institutions together in this area of providing health and environment leadership. Especially, I had an opportunity to participate as well as to come across the reports that have come out of some of the conclave and the roundtables that have been organized in the recent past. The one that was organized in very recently about the operating theatre, greening of the operating theatre, and the one that was organized about the healthcare workforce resilience, specifically of their mental health. And then there was another one about a shift in the plastics. These were very important topics, and I'm extremely glad that there was such a huge participation and such a wonderful report coming out of these roundtables. Looking at the agenda of the conference, I also note that this time we have very important sessions. It is unfortunate that I could not join myself in this particular conference, but I look forward for you all to have a very rich deliberations and discussion during this conference. The session that relates to technology, AI, telemedicine, the one specifically related to NABH, and the other one about the collaboration in resilient transformative healthcare and ESG in healthcare is likely to be a very important sessions of this conference. Dear friends, I am extremely happy and privileged to address this gathering of healthcare professionals. You all carry one of the most significant responsibilities in the society, the responsibility of safeguarding the human health while ensuring that our institutions remain resilient, efficient, and capable of serving future generations. When we think about sustainability, we often associate it with environmental protection, renewable energy, or climate change. But it's the ability of our hospitals to deliver high quality care consistently while balancing environmental stewardship, financial viability, operational efficiency, and social responsibility. Yet, healthcare systems themselves contribute significantly to the carbon emissions, waste generation, and water consumption, and also resource depletion. So it's a paradox that institutions which were dedicated to protecting health can intentionally contribute to environmental factors that threaten public health. As medical leaders, we are uniquely positioned to lead this transformation. The environmental imperative. Climate change is now a major public health challenge. Hospitals must therefore become a part of the solution. Simple measures like energy efficient lighting, optimized HVAC system, solar power adoption, water conservation program, and sustainable procurement practices would significantly reduce the operational cost while lowering the environmental impact. The economic imperative. Sustainability is often mistakenly viewed as an expense, while I think it's an investment. sustainable practices improve efficiency and reduce wasteful expenditure. Energy efficient infrastructure, digital documentation, optimized supply chain management can generate substantial long term savings. Moreover, investors, insurers, accreditation agencies, and even the patients today are increasingly evaluating healthcare institutions through the lens of sustainability. The social imperative. Healthcare sustainability is also about the people. It prioritizes the well being of the patients and healthcare workers and the communities, creating safe working environments, promoting professional development, and preventing burnout, and fostering a culture of respect and inclusion is what the sustainable healthcare brings about. In the meeting today, you will be discussing about the digital transformation. It is definitely a sustainability enabler. Technology is becoming one of the strongest drivers of sustainable healthcare. The electronic medical records, the telemedicine, the artificial intelligence, and all other relevant digital technologies are not only merely IT initiatives but are also sustainability strategy. In terms of leadership, I would say sustainability definitely requires leadership commitments. Whatever gets measured gets managed. By establishing measurable goals and monitoring progress, we can, as leaders, manage sustainability. In terms of private sector, I would say today India's private hospitals and private sector is becoming a global leader in terms of sustainable healthcare. And HELP, the Health and Environment Leadership Platform, has brought together so many of you together and has helped showcase what the India's private hospitals can do in terms of becoming health and environment leaders. Therefore, I would conclude that we are, as the custodians of the future healthcare, we should be committing ourselves to building hospitals and the ones that not only heal patients and strengthen communities but also protect the environment and also remain resilient for generations to come. And I wish a lot of success to this conference. Jai Hind.